Professor Sanjeev Gulati, Chairman, Nephrology and Kidney Transplant, Fortis and Escorts Group of Hospitals, NCR, and President-elect of the Indian Society of Nephrology. Today I will be sharing with you our experience of kidney transplants during COVID times. The COVID pandemic has been a great relearning for kidney specialists all over the world. As you all are aware, kidney patients, because of their immunosuppressed state, are at highest risk of infections. And among these, kidney transplant patients, because of their cumulative immunosuppression, are perhaps at the very highest risk. So when the COVID pandemic started, the transplant programs all over the world shut down because of fear and apprehension of the safety of kidney transplants during the COVID pandemic. However, as the experience grew, we noticed that the mortality in CKD stage 5 patients who were waitlisted for kidney transplants was between 25 to 30% for multiple reasons. Thereafter, in close collaboration with our international colleagues, we restarted the kidney transplant program at our center. And today I share with you our experience of 104 kidney transplants that have been done during the COVID pandemic. It is very heartening to know that none of these 104 patients developed COVID infection during the perioperative period. 2 of the 104 patients did develop COVID infection shortly after discharge, one in the second week and other the third week post-transplant. And none of these patients, 104 patients that we transplanted, died. In contrast, we did lose about 10 patients of our follow-up who had been transplanted long back. They developed very severe COVID infection and they died despite hospitalization. So the take-home message is that as compared to stage 5 chronic kidney disease patients, patients on kidney transplant do far better. Patients who have recent kidney transplants, because they have less cumulative immunosuppression, are perhaps at much lower risk as compared to patients who were transplanted years back and have greater immunosuppression cumulatively. Our experience in a collaborative work has been published in Transplantation Journal as well as eClinical Medicine. So, please reassure your stage 5 CKD patients that they can safely go ahead with kidney transplant during this pandemic which is continuing. Of course, they have to follow standard operating protocols and regular follow-up, and the outcomes are as good as kidney transplants during normal times. Thank you.